There's been a spike in measles cases in Otago-Southland, but the DHB says it needs to prioritise the vaccine. In the past 48 hours, 13 new measles cases have been confirmed in Queenstown, 2 in Wanaka and 1 in Dunedin. The Southern DHB says people who had the measles and were infectious at the time visited many Queenstown restaurants, ski fields, parks and shops over the last few weeks. I asked the Southern DHB's Medical Officer of Health, Dr. Susan Jack, for the latest.
As of this afternoon, we've now got 57 cases. Most of these are in the Queenstown area, so 52 of them, but we've got 2 in Wanaka, 2 in Dunedin and 1 in Oamaru.
So why this sudden uptick in cases, do you think?
I think we've had measles circulating in Queenstown and it's jumped into community transmission, and every 10 to 14 days you're going to get the contacts of the previous person who had measles, so we're just part of that pathway.
Do you think this has come in with travellers?
Most of our confirmed cases are living in Queenstown. We've had a couple of travellers, but most of them, it seems to be, have come from circulating in Queenstown.
Can you tell us, of the cases that you've got, are these people unvaccinated? Are they part of the immunity gap, or what is the situation?
So some of them are unvaccinated, but we do have some that have had at least one vaccine and a few that have actually been fully vaccinated. So it is a mixture, but a large proportion have been uncertain about their vaccination status.
So how many cases do you have where people have been fully vaccinated?
Just a few. I haven't got the exact numbers on hand, sorry.
Obviously, in people in isolation, have you got some people who have been asked to stay at home?
Yes, and that's one of our big ways that we can help control this outbreak, is by, if we have contacted people and asked them to be isolated, to do that very strictly. We have isolated some and then they have developed measles, and the great thing is that they haven't been out in the community while they're infectious because they've been isolated, so we've been able to contain it in that way. But now we're seeing an upsurge in our cases, and so if we ask you to be isolated, we do ask people to adhere to that.
So how many people have you asked to stay put?
We're probably, 150, 180 or so over the course of the last couple of months.
Yeah, because it's the school holidays right now, so I'm wondering, does that make it harder or easier?
Yeah, it depends on your family. Obviously, it is restrictive if we ask people to be isolated, but we're doing it in order to protect our most vulnerable in our communities, those people who can't be vaccinated, so pregnant women, people with cancer who may be immunocompromised, and young babies who are not even of the age to be vaccinated. So we're doing it so that we can contain the spread in our communities.
So what is the situation in terms of vaccines? How many vaccines have you got in your district?
So we've got adequate vaccine to do all our routine vaccination for children at 15 months and 4 years, and enough for if any children are late in getting those, we have adequate vaccine, and then we're working with the ministry to try and get extra vaccine down into our area.
So if an adult comes in to be vaccinated, will they get a vaccination?
Right now, they're not one of our priority groups, but we're working on that.
So when you say you've got enough for kids, in essence, how many vaccinations do you have? How many children can you vaccinate?
So we've worked with primary care, and I can't give you the exact numbers again, but we have got enough vaccine for anybody who's eligible for that under 5 age group.
Right, but in essence, you're rationing them, aren't you?
We're prioritising that group who should be having their routine vaccinations, yes.
So you've put out a list, I see, of venues, obviously, where people who have contracted the measles have been. If you are exposed or have been exposed, what's your status in terms of getting a vaccination, and would it do you any good?
Well, what we're asking people, if they think they've been to any of those areas at those times, to go home and check their vaccination records. If they've had 2 measles-containing vaccines, so 2 MMRs, then they're absolutely fine. If they're unvaccinated, then they should be looking out for signs and symptoms and isolate themselves if they become symptomatic.
But would they get vaccinated?
If they're completely unvaccinated or not fully vaccinated, at the moment we don't have enough vaccine for them.
Even if they've been in one of these areas, cafes, pool, gym, that you've listed here, they still wouldn't be a priority for a vaccination?
In the big scheme of things, yes, they're a priority, but right now we don't have enough vaccine, so we're needing to prioritise to our most vulnerable people, who are our young children.
And what kind of timeline have you been given in terms of getting access to more vaccines?
We're hoping that in the next few weeks we'll have access to more vaccine.
So, within a fortnight or longer?
We haven't been given the exact dates, I'm sorry.
Have they got problems with supply?
The Ministry are working hard to get adequate supplies into New Zealand.
But what have they told you about access to extra vaccines? What's the message you're getting?
They are working as hard as they can on that, so we're very hopeful that we'll be getting extra vaccine.
And that's Dr. Susan Jack, who's the Medical Officer of Health at the Southern DHB.